Good morning, everyone, and happy Friday. This is Athena Chapman. Happy to be here for the monthly California Collaborative for Long-Term Services Supports webinar. We're excited to do a follow-up webinar from something that we did a couple of months ago around Project Room Key and following up on the developments of Project Home Key. And so we're going to have a great panel here today to talk about some of the developments and some of the lessons learned as we have gone through the implementation of these big housing programs. And so we have a great panel. We're going to start off with Sasha Witowski-Kurgan from the Data and Research Unit at the Housing and Policing Division and the Housing and Community Development, which is working on Project Home Key implementation. And then we'll have Krista Gaeta, who's the director of the San Francisco IHSS program. And then Liz Tarzan, who's the director of Helping Aging at the Episcopal Community Services in San Francisco, giving the provider perspective. And Patty Prunhuber, senior housing attorney at Justice and Aging, will round us out with some big picture lessons learned and next steps for us as we move forward in our work here at the collaborative, and for those of you that are following work. So we're really excited to have a full panel. We did expand this to an hour and a half in order to have enough time for a good dialogue, because the last session that we had on Project Room Key was very much a lively discussion, and I think we ran out of time, so we wanted to be sure we had time. So please do use that chat function so that we can do some moderated Q&A at the end, and also feel free to raise your hand and we will call on folks as we get to that. But we're going to run through the panelists first and then have the moderated discussion at the end. So join me in welcoming our speakers, and we will hand it off to Sasha to kick it off.
Wonderful. Thank you, everyone. I'm going to share my screen and make sure that I have that going, but I want to thank you for having me today. I am the data and research actually, I am not certain that I can share my screen. So sorry.
That's okay. Nancy, you might have to stop screen sharing. Let's give it a shot.
Okay, thanks. Thanks everyone for your patience.
Wonderful virtual world, we all.
I know, here we are.
There we go.
Okay, great. So my name is Sasha Witowski-Kurgan. I'm in the Housing Policy Division at the State Department of Housing and Community Development. And this year I've been working on COVID response and now recovery through Project Home Key. And I've been working on Project Home Key since before it was called that, and as we were partnering with our friends and colleagues at the Department of Social Services and the Department of General Services that were working on the immediate response through Project Room Key. So today we'll talk about a few concepts, but I'm really excited to share with you and excited to hear your questions as well. Just the overview, and so you'll hear me say this a few times, we are very much in the program right now. So this is not a calm reflection on exactly how things went and how things turned out. We are in the middle of a lot of properties closing around the state. So we look forward to more reflections next year, but right now we want to give you a look back and a little bit of a point in time. So to do that, today I'm going to talk about—
Sasha?
Yes.
I'm so sorry to interrupt. Can you put this in like full screen mode? I think just start yeah, there we go.
Can you see the full screen, or can you see 18 screens? Because I can see too many on mine. You can see one screen?
No, we just see the full screen of the slides.
Perfect. That sounds great.
Yeah, thank you.
Thank you for the note. Thank you. So we'll talk about the success of Home Key and really start with where we're projecting outcomes, and then we'll go back to why we need Room Key and Home Key and future programs like these and others. Then we'll jump into the weeds of the program design, goals, and what a real project looks like. Today, if I was presenting to HCD staff, I would be talking about how this connects to our mission and vision. It connects to our core values as well. We are centered on addressing equity. We are centered on addressing homelessness and preventing and ending homelessness. And then we have a lot of other values that come up in our work. But this project has really allowed us to bring a lot of staff and a lot of local partners directly into our mission. So I'm also proud of that. Our tentative outcomes are these. We expect to have local partners acquire 6,000 doors, which will translate to 6,000 places to call home. We expect that that will serve in a year about 9,000 Californians. And the way that we get there is by using a pretty conservative estimate. These are not only single room properties that are being acquired, some are multiple rooms. So they're going to serve larger households. And then another reason why we're doing a multiplier here, which is like 1.5 to the 6,000 doors, is to consider that HomeKey allows for interim and permanent housing. So for the interim housing side, there are people who will join a HomeKey site and then will have an exit to permanent housing. So while they are at the HomeKey site, they will be connected with services. They will then move on outside of that property or to other permanent opportunities within their community. All of this happens within 90 days. One of the thresholds that we had for our program was really wrapped around urgency. We'll talk about why there's an urgency to act. I think it's a surprise to no one, but we're highly motivated to bring people inside. And so as part of the application, we asked all applicants to tell us, could they occupy the building within 90 days of acquisition? And if so, that helped to get them into a different tiering structure that we might talk about today. But we were really interested in, was that possible? And if so, let's prioritize properties and awardees who can meet that goal. Further, we provided points for awardees who could beat 90 days and actually occupy immediately or within 30 days. So we were trying to share our sense of urgency with the applicants and let them know this is not a program where we're looking too far into the future. We want people to be housed in quickly. So those are our preliminary outcomes. A little bit more about the need, why we did this. The state already knew it had a crisis that we needed to solve, and we've all known this. We see it, we feel it, everybody knows someone who has been affected by some symptom of the housing crisis. Specifically, more than a third of Californians right now, actually pre-COVID, are spending more than 30% of their income on housing costs. That's not counting transportation costs or medical costs, essential things, but we use 30% as actually housing professionals use 30% as a measure of rent burden. And if you're paying more than 30% of your income towards rent, you are making very difficult decisions, if not impossible decisions, on how else to use your limited funds. And so to have a third of the state experiencing that condition puts a lot of households at risk for experiencing homelessness because you're literally an emergency away. And so we see these patterns around the state. This is one map. We can do this in a variety of ways to show housing need or point in time count and people experiencing homelessness or the ratio in every community. And we intentionally chose these colors. We're not just bad cartographers, but we want to show that these conditions are not good anywhere, even when there's lower numbers of people experiencing homelessness in certain parts of the state. No one experiencing homelessness is the goal. So we're not trying to hide that there's a problem. So, and we see, higher concentrations in certain parts of the state, in the most expensive parts of the state. So these are all things that we know. But further, these outcomes and patterns reflect racial and ethnic inequities that are because of historic exclusion of people of color from buying homes or being able to live in certain neighborhoods, or accessing credit and good paying jobs, or being segregated and left out from local decisions. And all this leads to fewer community resources and basics like good schools and healthcare and transit and jobs and opportunity and connections to hospitals and things like this. That list goes on. We also see disparate impacts by disability status and age, and certainly within the housing crisis and definitely within the population of people experiencing homelessness. So knowing that so many households are one emergency away, 2020 comes and the emergency hits us all. And some of us can bear the brunt and work from home or find family members to help, or at the very least, quarantine safely. But not everyone can say that. And on top of that, when we look at some of the more current data, we look at some of the census pulse data that's coming out, to an assessment of who has confidence in paying rent, who has confidence that they're going to have income next month. Those numbers are tracking along the same types of disparities that we saw in housing burden, that we saw in people experiencing homelessness. So yes, everyone is feeling the effects of COVID, but the same people that were disproportionately affected by the housing crisis are also disproportionately affected by COVID economic impacts. So that said, it's bad everywhere. The same disparities are present, and the most vulnerable people are experiencing homelessness already, or who are at risk. Many are often older adults on fixed incomes and people with disabilities. So all of this became our target population. To look at people experiencing homelessness and to also look at people at risk for contracting COVID or who had contracted COVID. And that's where Roomkey stepped in. So I know you've talked about Roomkey, and Patty may talk about Roomkey as well, and other people may talk about Roomkey. So I'm not going to spend too much time on this, but really just want to highlight the differences between Roomkey and HomeKey. Project Roomkey being the state's immediate response and heavy partnership and collaboration between states and counties to address homelessness, leasing hotels, motels, and sometimes delivering trailers to create non-congregate shelter capacity while we were losing shelter capacity because of new social distancing or new distancing requirements. This is a short-term interim housing program. Many counties are still working with this program. The governor just extended some parts of the program. All of that is good news. More than 15,000 rooms and 1,300 trailers, more than 22,000 individuals served, high degrees of participation around the state, 55 out of 58 counties and 3 tribal nations. That is good to see people saying yes to coming up and continuing to collaborate with solutions to address homelessness. Those are good outcomes. It was launched in April 2020. Meanwhile, we were still working on other task forces within the state to figure out what else we were going to do. And we were starting to talk about what this looked like if we bought a big royal we here. Who the we was, what the actor would look like, was all part of the discussion. But in came HomeKey through the budget bill that wasn't released until the very end of June. So that's the time frame that we're working on. Roomkey started April. This year has moved in a blur for all kinds of reasons, but part of it was this: how can we keep continuity within Roomkey? Is there momentum? Is there governor and legislature support? There was, and so we continued in this vein of state and local partnership and chose to focus on a model of acquisition. And we'll talk about program design, but the reason why is really the need to act quickly. Both from the funding that we would be using, but also the urgency of bringing and keeping people inside. We couldn't just build new construction from scratch or from vacant lots. That wasn't the time frame that we were working in. So meanwhile, looking at what was going on nationally, we were starting to see decreases in travel and decreases in rates of hotel uses. And we had some hotel owners and chains reach out about the strategy, first on Roomkey, and then continued the conversation on HomeKey. Today, we see 20% occupancy in hotels around the nation. So it's not just in California. So the tenor of available properties has gotten a little bit louder. Anyway, back to HomeKey. We've figured that we would focus on interim and permanent housing, knowing that there's a high need for both in the state, and heavy focus on units being acquired and fully operational within 90 days. So a little bit on the overview of the program. We started with $550 million. We received another allocation of 200, so now we're at $750 million from the state's direct allocation of Federal Coronavirus Relief Fund. I'll try not to use acronyms, but if you hear me say CRF, that's what it is. Those federal rules require that all funds are expended by grantees by the end of this year, December 30th to be exact. Meanwhile, the legislature and governor also authorized additional funding, $50 million in general fund. And since we announced Home Key, we've received philanthropic contributions now totaling $46 million. The general fund and the philanthropy sources go towards operations to provide some operational support to awardees. All of those funds need to be spent by June 30th of 2022. Applicants here is a little bit different than some of our other programs. And I'm happy to say that we have a wide net cast, and you know, things like this are in the details, but it really relates to our outcomes and how inclusive we've been able to be. Some programs are targeted towards cities and counties, but here we were also able to include tribes, public housing authorities, and local public entities. So all of those entities could be in partnership with development sponsors, but we always need a public agency at the helm of the application. Our target population, we use HUD's definition for people experiencing homelessness or people at risk of homelessness, and also people that are impacted by COVID-19. Those definitions both focus on extremely low income individuals and households that are extremely rent burdened. So we looked at point in time count, and we also looked at severe rent burden, those households paying more than 50% of their income towards rent. And that's how we figured out our geographic spread around the state. One important part of Home Key to pull all of this off in the time frame that we need to act within is to provide technical assistance, and a lot of it. So we did some early engagement. I'll touch on that in the next slide, but we have created an ambassador program at HCD that is really just a single point of contact. And we assigned that ambassador after another required component of our technical assistance, which was a pre-application consultation. And the thinking here was that there is no way that we can release a notice of funding availability or a NOFA in July and ask for applications to be due at the end of September and expend funds by the end of the year and have applications come in September and have us know nothing about what the applicant is planning. That wasn't going to work. So we embedded this pre-application consultation to require that we talk with applicants before they submit their application. Give them a chance to ask questions, give us a chance to digest what their proposal might be and figure out, and also build some enthusiasm to say, yes, go, it sounds like you have a project, keep going, and keep us up to date. And so the ambassador becomes our point of contact. This also allowed a broader range of staff to step in and to provide some continuity in communication. We've also engaged the Department of General Services to act as the state's real estate agent to extend some of those same services. So our partners at DGS have done property needs assessment and supported on appraisals, either directly or evaluating them. They've also gone out to sites and advised on rehab scopes and done all kinds of other things. And so it's been great to extend HCD's mission to DGS as well. And they are committed to supporting an end to homelessness. We've also offered other TA that was a little bit softer, talking about braiding of funds and fair housing and equity strategies, connected to COCs, continua of care, and talked about some of the land use and planning strategies. That is important because we had some land use authority that came through the budget bill that is really significant. Two pieces here. One is that every Home Key property is deemed in conformance with any local land use plan, does not require a conditional use permit. This is, for the planners in the room, these are things that create delays in developing properties, and it was delay that we don't have right now. That we don't have time for right now. And then the other piece was a path to a CEQA exemption. There's a very specific CEQA exemption, and it doesn't work for all of the Home Key applicants. It just doesn't. But there are other pathways to CEQA exemption. So on HomeKey's website, we include a range of technical assistance documents that we made available and let people digest. And one of those is the Land Use and CEQA Authority. We worked on that with the Office of Planning and Research to try and help local jurisdictions wayfind through some of these complex regulations to say, let's just make sure that the land use component is not a barrier. Please use the tools within the planner's toolbox to make this happen. And so that has been assisted, but we've offered some support there. And also on data and analysis, we picked up a ton of data along the way. We didn't want any of these things to be barriers to applicants that had enthusiasm, had a good project, and just hadn't filled out a housing application before. There were a lot of people that had never said yes to housing in this regard. Our key program dates are listed here. We released our NOFA on July 16th and started accepting applications that day. So really the priority application period was a call to action, and people started submitting their applications very soon after that. That early pre-application period was our time for a geographic hold, where we said we'll hold this much funding, with about 80% of the funding to different geographies, apportioned by point in time count and severe rent burden. And then after August 13th, we can't hold anymore. We need to just keep moving to the next person. But we actually were fully subscribed at a first look within that priority application period. Final awards were targeted for October 20th. We have had some projects, like any real estate deal, fall out. So we've continued to go back and bring in properties from our dynamic waiting list because applicants have continued to keep us up to speed. Whether or not some applicants received HomeKey funding, they were going to do this strategy anyway. We love that. So we're here to be partners to them. And also when we can't fund them with HomeKey funds, we want to talk to them about if we can help tee them up for any other funding, state, federal, anything. If they have enthusiasm to work on this strategy, we want to be good partners to them. Okay, that was a lot. So just to cover some of our program design goals, we really baked in equity in any place that we could. So a couple things that I want to touch on here. I talked about the geographic distribution. That was part of it. We wanted to make sure that just not the loudest voices or the highest capacity jurisdictions took down all the funds immediately. So we held and made sure that there was space for all jurisdictions to submit an application before folks had to compete against each other. We wanted the awardees to focus on the target population and whatever that looked like in their community, knowing that there are a range of services that already existed. We wanted to understand what other services they would need to bring to the site, what their plans were for connecting this property, rehabbing the property if needed, and then acknowledging that there are racial disparities in serving people experiencing homelessness. And so we asked or encouraged applicants to look at that and tell us what they saw, both from a data perspective, and then also tell us what they would do. And some of these were points considerations, so it wasn't a bar that we set for everyone, but we rather challenged the awardees to be introspective and tell us what they were seeing in their community and what they could commit to address disparities. And this could be along racial or ethnic lines or along age and disability status, but to tell us where those disparities exist and then what they would do to address those. We also tried to build in flexibility. So creating those immediate housing opportunities, HomeKey is served really as an acquisition program, and then allow for longer term investments. So this looks like some awardees that are going in for interim housing immediately will stabilize as that and position their property for a permanent housing conversion where they may bring in other funding into the project, do other rehab and things like that. So there are a lot of awardees that are in that category. There are some awardees that want to function as interim housing in perpetuity. That is also okay. And there are some awardees that wanted to function as permanent housing immediately. And the properties that they purchased were equipped already to facilitate that, having kitchenettes, having services space on site and things like that. We also, while we moved quickly, we were doing program design and working with stakeholders along the way. So we released a survey right as the budget negotiations were closing. We received about 200 responses. We held 30 of those calls before we even released the NOFA to hear other thoughts on what would be useful, how we could be helpful. And then when we launched the NOFA, we started doing those pre-application consultations. We held 101 pre-application consultations. So to that many cities, counties, tribes, housing authorities we spoke to around the state, we ended up landing with just over 50 unique awardees. So more than 90 projects, 50 awardees. So a lot of applicants came back with multiple projects and portfolios that they presented to us, but still have really good coverage around the state. Again, a lot of talking, so I just want to put this in context of a property. So this is a project that is a property that is in Redwood City, but it was an application put forward by San Mateo County. 95 units in total. They're going in with an immediate strategy for interim housing, but they will convert to permanent over time. They will be 100% occupied by next spring. There is a bus stop immediately outside of the building, and it's already a very well-maintained building with 1 and 2 bedrooms and kitchenettes. So this makes for a pretty quick conversion. I think their understanding is they want to align some other funding to really stabilize the occupancy, but their target population, people experiencing homeless and low-income seniors. And they will have wraparound services on site. And then we also bolster that by saying, what else do you have in the community and how can you connect your property to existing resources? So 95 new units in a part of the state that is hard to build in sometimes and hard to bring units online. So really happy to see a partnership between Redwood City and San Mateo County. I look forward to hearing the other presenters today. I just want to let you know you can always reach out to our team by contacting us at homekey@hcd.ca.gov. Our HomeKey website has all the TA resources that I described. I look forward to hearing from this group, not just today, but in the future, letting us know what you hear, let us know what you think about the strategy. We will pause for reflections, but we're really looking forward to 2021 for a whole host of reasons, including looking to see how these community visions are realized, having these projects coming online, and then developing more of a community of practice to do reflections with the awardees and figure out how to support this strategy elsewhere. So my comms folks also remind me to tell you that you can sign up for our website, on our website for our email address, or for our email distribution, sorry, Friday, need more coffee. Here we are, and you can follow us on all the channels. So that is all I have, and I will turn it back over to Athena.
Great, thank you so much. So much great information. Really interesting to hear how this has really touched, every community, right? So, but thank you for all that. A lot done in a short amount of time, and looking forward to seeing how all those projects turn out. So I'm going to move right along here. We'll have Q&A at the end, so please do put your questions in the chat as they come along. But I'm going to hand it off to Krista from the San Francisco In-Home Supportive Services Program. Krista?
Good morning. Thank you so much. Let me just quickly get us to the beginning of this presentation. All right. All right. Good morning, everyone, and thank you for having us here today. My name is Krista Gate. I'm the Director of In-Home Supportive Services in San Francisco. And I'm joined here by 2 of my colleagues, Ricky D'Armond, who is the Director of Programs at Homebridge, and Fanny Lapitan, who is the Program Manager of our Office of Community Partnerships. And they're going to both talk a little bit more about how they fit into this project. So today, our goal is to talk about what we did in San Francisco, sort of locally, to implement support in our Project Room Key program for older adults and people with disabilities, really using an in-home supportive services model. So we're going to kind of go over our partners and on our system overview in San Francisco, and then we're going to talk about how we collaborated and really leveraged our existing services to really quickly pivot and respond to this crisis. Then we'll talk specifically about what we did in Project Roomkey, or are continuing to do. Talk a little bit about the transition. We're not experts on that, but sort of what we're sort of focused on. And then lastly, talk about some of our findings and recommendations for things that we've learned that we can continue to do to better serve folks. So first of all, IHSS in San Francisco lives in the Department of Disability and Aging Services. And what was really amazing about what we did was it was a very strong collaboration, and we really couldn't have done this without the key partners. And one of those is Fannie, who is going to talk about Office of Community Partnerships and sort of all of these services that they provide on an ongoing basis, in particular with the group Institute on Aging, and then Homebridge, who is a contract mode provider in San Francisco, and how we work together to really respond quickly. So first of all, San Francisco has designed our IHSS services as what we call a San Francisco IHSS continuum of choice and support. And really what this model does, and we sort of came up with this several years ago and said, not all IHSS recipients are alike. Everyone needs a little bit of something different in order to really thrive in the service. And so we sort of organized our services on this continuum from pre-designated, which are folks who are really independent and kind of come to the service already knowing who they need, who is going to provide their service and can really self-advocate, all the way through to Homebridge, which is something very unique in San Francisco. And that's for folks who do need some extra support in order to hire and thrive in the service. So we're going to go over that continuum right now and what role we each play. So first of all, while the county plays a role in all of these different levels of service in IHSS, we are most focused on the pre-designated IP, and this is the largest group. It's about 90-ish% of our population comes to the system with a pre-designated IP. That can be a family member, a friend, or somebody that they hire on their own. And so we basically take care of the IHSS social worker assessment. So we go out and we assess folks in their home. Not that right now we're doing that on the phone because of COVID. We authorize hours based on the mandated state assessment, and then we take care of the IP enrollment. So doing the mandated state orientation, and then getting them into the system and connecting them with their provider so that they can start to serve the hours and get paid. So just a little context, San Francisco is considered a large county. We have over 23,000 recipients of IHSS and over 22,000 independent providers providing care. And a good portion of our clients actually live alone, 40%, which 32% of our cases considered severely impaired. One of the sort of unique things about our population is a good portion of let's see if I can move this. Clients are monolingual, non-English speakers, mostly Cantonese. Most of our population is older, so 76% are over 65. We have a very young population. While the minor population is one of the faster growing across the state, it actually is not in San Francisco, likely because of some of the cost of having a family in San Francisco. And then today, we don't have the public authority here, but they are a huge part of our continuum of choice and support. And so they provide three very important services that meet people at different levels. So first is our registry service. This is something that is provided across the state. All counties have one. And this really is for the benefit of the recipient. They have a list of available IPs. They can call, they can talk about some of their preferences in terms of types of services they need provided, times, et cetera. They will send them a list of available folks and they can call and then hire that person on their own. One of the things that we recognized years ago was that, it's really hard to be an employer. Many of us are managers. You can say that's probably the hardest part of my job, actually. And so, hiring people, knowing what questions to ask, setting up a schedule, being able to direct somebody, those are signing timesheets, holding someone accountable. All of those things are pretty difficult. And not all not all recipients were coming to the system knowing how to do that. So perhaps they could direct their service. They knew what they needed, but all of that administrative stuff was pretty difficult. So we created the mentorship program. And so this is a group of folks who can really work with recipients, go over the list with them, talk about what kind of interview questions you want to ask. Like sometimes they participate in the interview, they help them set up the contract, and they really sort of support them through that administrative part of the job, or the service. And that has been a really great addition to our IHSS continuum. And then lastly, we have an on-call system or an emergency backup system. And so this is really for folks when their provider calls out sick or goes on vacation, they can call us, we can set them up with the public authorities on-call system, and we can do short-term assignments with them. And also when people are just between providers. And that is and also actually one of the really helpful ones is when people come directly out of the hospital, we can get people home quickly because we have this on-call that can sort of patch before we get a permanent provider in place. So these are all really important services that really we were able to leverage during the pandemic that we won't really talk about today, but we're really helping us keep folks, safe at home during in their homes during this pandemic. So now I'm going to hand it over to my colleague Ricky, who's going to talk about Homebridge and our contract mode side of our continuum.
Thank you, Krista. So as Krista mentioned, Homebridge is kind of unique service that's provided in San Francisco. So we are actually a nonprofit organization that's contracted through DOS to provide approved IHSS services. And really the key component of for Homebridge is that we hire, manage, train, schedule, supervise the providers that work with individuals who are with us. So you'll kind of see, we'll talk a little bit more about like our different tiering of clients. You see supported services of a tier of client is probably someone we're doing really basic service coordination and caregiver management, up to our critical services and where we're doing full service coordination, care management, and caregiver management. And I guess, Krista, the next slide. So an overview of us, like we've talked a lot, like, so for recipients who can't manage their own provider, which is around what we serve, around 1,200 recipients a year, which is a, less than 5% population of the IHSS recipients in San Francisco. So with the 840 monthly average caseload that we have around 300 providers that are in the field, which we consider really as tech savvy. As we've equipped each of our providers have smartphones, which they can see their schedule and their individualized care plans. So as they're out in the community moving around, they're able to see multiple clients in a day and see the type of services they're supposed to provide, which I will pause and say that has been a huge benefit in the shelter in place type settings and getting around, is being able to use FaceTime and different things to stay connected to our clients. I think something unique to Homebridge is that we have the ability to offer paramedical services, which is not something that exists heavily in the general IHSS provider population. So we have a nurse practitioner, an LVN, who oversees the classroom and kind of at-home training for paramedical services, which include things like catheter care, tube feeding, bowel care, and glucose checks. And then another large thing that we do at Homebridge is our training program, which is available to any IHSS provider in San Francisco. And last year we trained around 1,900, and having this established training program was really something that we'll talk about on our approach, or our CERT team that we launched during the shelter in place. We already had it established and we're able to use those folks to train our providers. Just the next slide, Krista. So here you kind of see like the demographics of our clients. And then earlier I talked about these different tiers. You can see the percentage of where our clients fall into, and then the number of hours they're served. But really what I kind of want to highlight is the differences. So earlier Krista mentioned that IHSS recipients in San Francisco, the majority are Asian. Where Homebridge, you see that our recipients, that represents about 8% of our current contract mode clients. And while 76% of IHSS recipients in SF are reported to be 65 years plus, at Homebridge, only about 50% of our clients fall into that 65 plus category. And something that really stands out as where the majority of IHSS recipients are in San Francisco, 40% of them live alone. About 80% of our clients do live alone. And a lot of that is because what you see here, with the majority of our folks falling in intensive and supported. So those are typically individuals who have experienced homelessness and currently live like in permanent supported housing areas. So with our providers, we've been able to meet their needs in those categories of like in permanent supportive housing. And I guess Krista, next slide, I think.
All right.
Fanny.
All right, Fanny.
Thank you. Thanks, Ricky and Krista. Hello again. I'm Fanny Lapitan, Program Manager for the Office of Community Partnerships. So our office, the Office of Community Partnerships, or OCP, is part of the San Francisco Department of Disability and Aging Services, and which is the area agency on aging in the County of San Francisco. We provide information and referral on a range of services that assist older adults, adults with disabilities, and their caregivers. And we also fund programs through grants and contracts that help support the ability of our constituents to live and thrive independently. We currently work with over 60 community-based organizations and manage over 86 million in contracts and grants. Some of the program areas that we fund include nutrition, case management, community services, adult day services, LGBTQ programs, and much, much more. One of the organizations that we closely collaborate with is the Institute on Aging. This is a nonprofit organization in California that provides innovative community-based programs related to health services, social support, education, and advocacy. IOA is currently working with us to provide intensive case management through the Community Living Fund program. So the Community Living Fund, this is a fund, the primary goal is to support and enable community living for individuals who would otherwise be in settings like skilled nursing facilities or hospitals. The program provides care coordination and purchase of goods and services. We help our participants by making sure they have the care they need to maintain their health, well-being, and independence in the community or a setting of their preference. So this includes purchasing one-time only items or bridging services they might need to keep them safe. The funds through the CLF program are intended to be used temporarily and as a last resort. Since the beginning of the CLF program in 2007, we've served over 2,000 individuals and have purchased over 17 million in goods and services. So this is a little bit about our office and the Community Living Fund. Krista, back to you.
Great, thanks everyone. So I think one of the things we really wanted to highlight in our presentation today and our response is leverage. You know, when this first started, no one was prepared for a global pandemic. We were all preparing for wildfires and smoke and so many other things, heat waves, et cetera. And then all of a sudden this happened and we all sort of turned to each other and said, oh no, what do we do? And I just am so grateful that I had partners like Homebridge, the Public Authority, and the Office of Community Partnership and all of their nonprofits, because we didn't have to build from scratch. We actually took existing programs in every single one of our responses and we leveraged them and we just modified them to meet the need that we had in front of us. And it actually allowed us to move very quickly and respond to make sure that what we're going to talk about today in particular is that our folks experiencing homelessness, in particular those that are older or have disabilities, were able to access those hotels and be safe in them and be able to shelter in place. So I cannot stress enough how critical like those existing services and relationships were in our ability to move fast and be successful in our response. So immediately, like I said, we got together pretty quickly at the beginning of March, and we came up with a set of responses that we felt were needed to support our community at large. We're going to mostly focus on Project Room Key today, but wanted to talk very briefly about some of the other things we did. One was we wanted to focus on public education. And so together and in collaboration with the Family Caregiver Alliance, we created a webinar series we made available to our recipients and providers and also to our community social service providers to get them information on universal precautions, on how to work with folks who are experiencing Alzheimer's during this time, et cetera, so that people had the necessary information to stay safe. The second thing we did was really focus on what are the sort of resources that we could get out to folks. So one was personal protective equipment. We already had a PPE program for our independent providers in San Francisco, and we were able to ramp it up with state support. But just really understanding that 21,000, 22,000 folks were out there serving continually because they were considered essential workers, making sure that they had the equipment they needed to stay safe and keep the recipients safe. We also were able to offer them hotels if they couldn't shelter in place themselves. So we had many IPs and many homebridge workers who actually were able to use hotels while they served folks who were COVID unknown or COVID positive or got COVID themselves. And we were also able to get them resources to a shared, well, not shared, I'm sorry, a transportation service. And then also we got a bunch of Safeway gift cards, so we're able to get food to our IHSS recipients who needed it. The other thing we did was our backup home care expansion. So many of you, I just talked about our on-call, our emergency on-call in IHSS. So that was already there. We expanded it. We paid those workers a little bit more to make sure that they stayed available and they were kind of getting that hazard pay because we knew that some of the fears had gone up. But what we also did was we expanded it to folks who did not have IHSS. So we actually created opportunities to be served by our specialized team who could work with COVID positive folks, who could work with our IHSS on-call service, and then also something we're not talking about today, but IOA, or Institute on Aging, also had a support at home program, and they also provided some care to folks who did not, who needed some backup home care while their provider could not provide the service. Luckily, that wasn't used a whole lot, and so we're really glad to know that most people's care stayed in place, but we were glad that we had it just in case folks needed it. And then lastly, what became a huge part of our effort was Project Room Key, and really working in those hotels to make sure that folks could get into those hotels and then stay safely in them. And then now we're sort of working on transition into permanent supportive housing. All right. So don't focus too much on this. I think what we wanted to show is that we had an incredible amount of data and to work together. We created shared drop boxes. We created shared database systems, and then created daily dashboards that allowed us all to sort of communicate and make sure that we stayed on top of everything. So this is not updated, this is from a long time ago, but it was, I think it was just really showing and highlighting the need for that type of shared information and collaboration in order to keep on track and make sure that we were doing a good job. So let's go. I see that there are a few questions. Let me see if there's something. Maybe those are from a different, those might be, we will talk a little bit about some of our lessons, and then I'm sure there are other folks who can talk about some of those lessons. So we'll do that right at the end. So in San Francisco, the Human Service Agency was responsible for mass housing during a disaster. They were also responsible for vulnerable populations, which the Department of Aging, Disability and Aging Services was charged with. We work under the umbrella of the Human Service Agency. So we were right there with them in the Emergency Operations Center, working hand in hand. As they were setting up housing, we were really able to inform them and advise on what was going to be needed for older adults and people with disabilities moving into these units. And that was a great collaboration. I think really as well, like that upfront work really helped us in our response. And some of the major goals of that were to facilitate hospital discharges, and Fanny will talk more about the work we did. So to get people out of the hospital, like San Francisco General Hospital, or out of our Laguna Honda skilled nursing facility, to really make room in there for people as they got sick, so people didn't have medical need to be there. How do we get them out safely, connect them to home care, and make sure that they could stay? Two was congregate thinning, knowing that the shelters were not set up in a way that allowed for safe distancing. So how do we get some folks out of there and into these rooms so that we could safely distance folks? And then lastly was to get vulnerable folks that were unsheltered from the streets and move them in. So this was a huge collaboration with HSA, the Human Service Agency, the Department of Disability and Aging Services, and then also working with our Homelessness and Housing Department, our Public Health Department, which also oversees the Behavioral Health Department. And I have to say, this was one of the greatest collaborations I've been a part of since I've worked in the city for about 3 years. And it was so great for all of us to have such easy access to each other. And that type of work together is what made this so smooth. A lot of times we're working in these silos, but because we were able to come together, we were able to patch all the different things that folks needed to stay safe. And then countless CBOs. I don't want to leave out our community-based organization. I know Liz Tarzan is here, who I invited, and they are just fantastic in San Francisco and did so much of the on-the-ground work. All right. Does that? All right. So this is some data updated as of 11/16, and we're going to give you the link to this data. We have what's called SF data. It's all the information on our alternative housing sites in San Francisco. So you can see right now there's a total of 3,500 alternative housing sites in San Francisco that are available. Of those, you can see here some were SIP hotels or shelter-in-place hotels. There were 2,600. 2,000 are still occupied, and then you can see what was in the congregate setting, and then isolation and quarantine. And this is where for folks who were tested COVID positive, and they could stay there safely. Shelter, there were nurses. It was sort of like a nursing ward. It was amazing. What public health nurses are my favorite, by the way. So if any public health nurses on the call, they just did a phenomenal job of setting those hotels up and being able to really care for people while they recovered. So then this sort of talks about unique individuals served. So about 7,000 folks were served in our program. Total discharge from SIP hotels, about 1,000 have been discharged so far. In terms of demographics, so you can see here mostly male. And then in terms of older adults, this isn't quite how we would probably break up these tiers, but you can see that about 25% were over 60. And then most folks were coming directly from the streets, and many coming from shelters. So what did we exactly do? So we knew that our normal system was not going to work in this crisis model, and we had to make big changes. So what we did was, as many of you know, you apply, it could take up to 90 days to get approved. That was not going to work. And so what we did was we created a very flexible system in order to do this in the Project Roomkey sites. We set up an email address, we set up self-referral forms and site referral forms. Actually, Liz, who's going to talk soon, helped me. We just ran into each other in the hotel one day and she just whipped a form up and we just put it into production. It was that quick and how we were working. We set up an emergency on-call number that went directly to the nurse at Homebridge that was available 7 days a week. So if somebody got to the hotel, we could serve them immediately. And then we were there for all move-ins. So we were there on site. So if somebody came in and needed help getting to their room and settling in, we could immediately start services for them and then get that IHSS assessment at the end. And then we really made a decision early on to say, are we going to let IHSS assessment and authorization be a barrier to service? And our county was really great and said, no, let's not do that. Let's do our best to get folks onto IHSS so that we can maximize reimbursement, but we're not going to let that be a barrier to start serving right away, because what our biggest goal right now is to get folks into housing and make sure that they're there safely. And we'll sort of talk about some of our lessons. We were able to get many people on, but there were some folks that was more difficult to get on.
So Krista, in the interest of time, I'm gonna have you, maybe we can hit on some of the lessons learned and stuff during the Q&A, because I know people are interested, but I do want to make sure that Liz gets an opportunity to go on. So if you have just a few last comments you want to make, and then we'll pass it off to Liz.
Sure.
Great.
Oh, I'm sorry. I thought we had a half an hour. My bad. Okay. Let's see.
We can come back to it because I know some of this will come up in the Q&A, but I want to go through and then we'll hit on that.
Sure. Sorry, everybody. I'm moving through your slides. We'll just go to lessons learned. So just really quickly, we think that there is a lot that the IHSS system can do to better serve unsheltered folks and people moving into housing. Just a lot more flexibilities into the service and more models that allow us to serve in congregate settings and really sort of make contract mode more available. Two, we think that there's some efficiency that can be done to we really see that there are folks who need a little more hand holding than others. And then lastly is just our ongoing investment and support of caregivers in the system who are doing that great work outside. Sorry, Athena, for going on so long. I thought we had 30 minutes, so my apologies. but we're
No
happy to
worries
answer
at
any other
all. Sorry.
questions later. Yeah, no worries.
No worries. It's always so much good information. I hate to cut people off, and I'm sure we can come back to some of that, but I do want to make sure we get a chance to hear from Liz and Patty, and then we'll wrap back around. And we guess we should have made it 2 hours, so lesson learned, hot topics. So I'm going to go ahead and Liz, pass it off to you. We're going to go ahead and hear from you as a direct service provider. I know Krista has mentioned you already, and we're looking forward to hear some of your experience on the ground. So thanks, everybody.
Thank you so much. You guys have my slides. Perfect. All right, thank you. So as mentioned, my name is Liz Tarzan. I'm the Director of Healthy Aging for Episcopal Community Services. And we can go to the next slide, and I can speak from here. So I'm here to present a perspective from inside what's happening when we do get a Project Home Key building rather. We have so far acquired one. We're in the process of acquiring a second one. And so we have been doing supportive housing for many decades now. So this is actually what Episcopal Community Services does here. We, in addition to doing interim housing and supportive housing, we also have behavioral health and workforce. And then we also oversee adult coordinated entry. And so this is in partnership with the city. Which gives us some insight into filling our rooms, but that's across the city, not just with ECS. And then healthy aging works actually across all of these departments, making sure that all of our senior issues are attended to, and making sure that we are able to provide the highest quality of life we possibly can. So I am going to today hopefully give you some good insight on what we are going to expect, who we can expect to move into these Project Home Key buildings, what kind of challenges we're going to anticipate just based on our previous work in the supportive housing, what our individual buildings are already showing us with some challenges, and the services that we provide to help attend to them, and then how creative we're going to need to be to attend to the brand new ones that we're going to be facing. So next slide. So first I wanted to go back a little bit, indulge me here, to the Project Room Key, because we are overseeing 8 sites right now. And as we know that Project Home Key, certainly in San Francisco, our buildings are going into the supportive housing cachet. And so all rooms will be filled through coordinated entry. And so that means that they will be coming from the SIP hotels, from the other unsheltered locations that we have. So our building, so this is the census from our 8 sites here. And what I find most interesting here is we're looking at 50 to 69. And I'm identifying that, and it's 52% of all of our guests right now, which isn't terribly surprising, as they did tend to bring in the older and the more vulnerable. But I also have to mention that we do not have the most vulnerable. Most of our hotels were actually or many of them were in the latter part of filling. So the most vulnerable are elsewhere. But still they have a lot of needs. But to identify 50 to 59 specifically, and 26% of them, it's just a trickier type of age to fill, because as we know, as we've been informed through a few studies, aging does occur more rapidly when experiencing homelessness. And so when I'm looking at seniors in my world, I'm looking at those who are 50 and above. So, and then services for 50 to 59 are not necessarily as easy to get for those who are 60 and 65 and can get the senior services. So there might be more work for us to do to help get them housing ready, to help identify income maybe, or even retraining, or whatever may need to be done. So this gives us a clue on what we might need to do to get them more, to get them into housing. And then of course, 60% are just plain old over 50 in all of our hotels right now, our SIP sites. The beneficial services, I can't say enough about IHS and Homebridge. This has been extremely pivotal in the success of our guests at the hotels. The meal services have been phenomenal. On-site on-site nursing. I will second what Krista said. They have been amazing. And then hourly wellness checks really do help to keep things going and identify any issues coming up and not let anything linger too long. Our challenges, just wanted to mention some of those. Not enough ADA rooms. We did a lot of switching around in the hotels to make sure that they got the people who needed them the most were able to get them. Dietary needs cannot be met through meals. Of course, that means our diabetics, for one, are challenged. And then these next three are a theme. So no matter what we're in, if we're in shelters, if we're in SIP sites, if we're in supportive housing, these are the three biggest challenges that all staffs have in these buildings. And so I'm still always on the hunt for the most ideal services to help with them. And it's usually people, more people. But dementia, forgetfulness, mental health issues, and hoarding and cluttering always are the issues of the moment. Next slide, please. So here's what any Project Home Key building we acquire, we will treat like our regular supportive housing. So currently we have 14 supportive housing sites. There's an additional 6 more to open by the end of 2021. 2 of them are the SIP sites, or rather the Project Home Key sites that I will talk about in just a moment. And one is an actual all senior site, and I will actually talk about that in a moment as well. And so that will more than double our capacity, and we're, and yay, we want more and more. So our current census in our housing is 1388, and I want to point out our housing is just aging. So no matter what we are bringing into our Project Home Key sites of all ages, we won't, they won't be senior specific buildings, but they will end up being senior buildings just based on the majority when we're looking at 50 and above. So my job as the Director of Healthy Aging is to make sure that services are available to all of these people and the senior services specifically. And so the current services that we have at all of our sites, we do have IHSS. We don't have Homebridge except in one building coming up, and I'll get back to that. Meal services only during COVID. So we don't otherwise have meal services, which makes it sometimes a little tricky. And of course, we bring in every meal delivery service we can with all of our clients. We have on-site case management. We do have access to clinicians through our behavioral health department. We do have on-site food bank distribution, health and wellness programming, and then the most exciting one to attend to those mental health issues is that we are building a new clinical program to provide expanded case management and therapy that will be billed through Medi-Cal. And so that we are very much looking forward to getting into every building in order to really attend better to the mental health issues that we see all the time. And then there are those 3 challenges again, they're everywhere. So we're always needing to attend to them. The hoarding and cluttering is a tough one. Hoarding and cluttering is a tough one just because there's not a whole lot of service to do that. We cannot depend on any IHSS worker to attend to that. We would never. And so it's tricky. Okay, next. So I wanted to give you an idea of what I'm finding to be the ideal senior housing, and I hope to get any new building, whether it be Project Home Key or any other one, as close to this as possible, because as we can see, we can pretty much anticipate that 50% of them will be 50 and over. So this one is in the process. We just broke ground, I want to say in September, and it's on 7th Street in San Francisco. This was a partnership between ECS, Mercy Housing, and Mayor's Office of Housing and Community Development. Total of 156 units, 152 of them are for adults, and it's on one side of the building, having its own side and own access. Then the other side is 104 dedicated to highly vulnerable seniors. And so these are seniors who are coming directly from the street, and so highly vulnerable. So we need all the services we can. So the confirmed services we have right now, we will have walk-in showers. And I know it seems odd maybe that I included it on that list, but when I walked in the door, they were all bathtubs. And so we had to do a little bit of renegotiating to get walk-in showers after I explained the benefit of walk-in showers over tubs, particularly for vulnerable seniors. Case management, of course, will be on site, and these will be senior specific. They will be senior trained for all of the services for seniors. And then my favorite, the biscuit model, building services care team, or building specific care team rather. And this is where we are partnering with Homebridge, and Homebridge will have its own office and they will be embedded in the building, and we could not be more thrilled with it. That is going to be a really, really important key to the longevity of these seniors, and aging in place is our ultimate goal. So that is going to be a big, big bonus for it. And then of course, health and wellness programming. Additional services we want to add in, of course, are meals. The chef's program that we do actually will be on the first floor of this building. So we do have opportunity. So we'll just be finding the funding for it. And then we're looking to see what we could possibly do with smart apartment modifications and just make things as easy as possible. We certainly need to consider how we're going to create options for telehealth for these seniors. You know, if they don't have to leave the building and they're frail, then great. And we have a way for them not to do it. That's fantastic. Lots of space, lots of community rooms. And so this again is our ideal model, and we hope to be able to place it in as many buildings as we possibly can, including Project Home Key as wherever we can, which we can go to the next slide. So this is the building we are currently working on. It's been in our possession for about 7 days now. And so we are learning very, very quickly what's going on and what we need to do to get it ready, and also to attend to the current residents. And that is really the biggest challenge right now. I want to say 82 residents are currently there. They are approximately 75% 65 and over. There are several very frail seniors. And so what we're facing right now is a few things. First of all, as Sasha mentioned, we've got a fast turnaround. We need to get this rented up very quickly, and our coordinated entry is all over it. So that's one. And then, you know, but attending to the current residents, they have a meal plan right now that can't really be supported in its current way. And so we have to figure this out. They do not have refrigerators. They do not have microwaves. And these are, as I mentioned, very frail folks. So we need to figure out some kind of meal plan to sustain them and make sure that they can get the necessary nutrition. And then there's changing services happening. So one might sound minor, but probably not to this group, but they had linen service. And unfortunately, our budget does not allow for linen service. So we have to figure this out, and we have to probably work with IHSS and try and figure it out. What we're doing right now is we've got our case managers going through the building and talking to every single current resident, and we're creating their own list of needs, and we're looking for patterns, we're looking for solutions, we're looking for what we can implement to make sure that they can stay there comfortably and for as long as possible. Aging in place is what my whole world is about. So that's what I'm always thinking of as the end goal. these are our services that we're automatically going to put in, and then this list will grow as we get to know this building more and more, and seek out and hopefully obtain our funding that we will need to get all of these things in there. And we look forward to doing that. And that's what I have for you. If you want to go back to the first page, and then my contact information is on that one. So you are welcome to call me, email me if you have any questions or want to know more about anything, please do. And thank you so much.
Thank you so much. And I think at this time we will turn to Patty. Patty is with Justice and Aging, and she's sort of going to give us the what now perspective. And I know we're running a little bit behind time, but I see that our speakers are kindly answering questions in the Q&A chat box, so you can kind of check out there if you submitted a question. There might be a response, and hopefully we'll have a little bit of time at the end for Q&A as well. So Patty, I don't want to take any more of your time. Go ahead and jump in when you're ready.
Thanks so much. And I just want to say this has been a terrific panel. I've learned a lot. And I think remembering that those who are really on the ground doing this work have the best sense of how to do exactly what the topic is, which is how to meet the needs of older adults and people with disabilities who are experiencing homelessness. I'm going to be actually very quick because there's been such thoroughness. Can we go to the next slide? Just a quick recap. You've already heard about Project Roomkey, and I just want to call out that I'm going to give you a lot of critiques, but I want to say that I think Project Roomkey did more towards addressing the crisis of homelessness in California than we thought was possible in a short period of time. And it shows that when we have a crisis, we have an opportunity, and we should think about that in terms of how we go forward. There was an amazing response to provide safe shelter to over 22,000 people statewide, and to identify and prioritize those at greatest risk, which included people who are 65 and over, and also people who had a health condition which put them at risk. We also learned a lot about the service needs of those most at risk. I feel like we've heard a lot from San Francisco's wonderful model, and so you might have in San Francisco already had a sense of the depth of those service needs and the variety of them, but that in other communities, I think they were caught up short, surprised by how much people needed supports and accommodations and help with basic activities of daily living. And because of that, we have a sort of mixed record in the counties on how people with disabilities and people who needed help with personal care were served through Project Roomkey. And so I think I want to give you a little bit of data, which I don't have statewide, but I do have some interesting data from Los Angeles. And in Los Angeles, which, remember is probably over a third of our statewide homelessness count is in Los Angeles County. In Los Angeles, from the Project Roomkey waitlist data, 2,454 individuals aged 65 and older were put on the wait list, or 15% of all people who were placed in the community queue for a room. That's pretty low. And one of the reasons is, one of the questions they asked was, do you need help with ADLs? And the guidance was that if you did, you weren't eligible for Project Roomkey. That was at least until August 4th. And of all the individuals who were placed, of those 6,915 individuals who did get enrolled in Project Roomkey in Los Angeles, about 1,300 were age 65 and older. So much lower than in other communities. And given that they are those at greatest risk from COVID, that's very troubling. So the other question is, here we are winding down Project Roomkey, but we're in the midst of a pandemic surge. So the question is, now what? If you could go to the next slide. So who got left behind? And I want to really contextualize this by my first comments, which is what was accomplished was really impressive. And yet I'm going to show some places where we could have done better on a statewide basis. So when we talk about 22,000 people who were housed statewide, that is impressive, but it doesn't address the number of people who were either unsheltered or living in congregate shelter and identified as at highest risk. So many people at highest risk, just so you know, are still on the street or in some form of congregate shelter. And some were not served by Project Roomkey because the program specifically excluded them. And I know we've focused on Los Angeles County as a place where those who were most at risk and should have been housed first were denied shelter because they needed more care. But it's not the only county. I've heard that that's true in San Diego and other counties. And I think, you know, we want to be really clear that and I'm sure people get San Francisco fatigue, but the ability to say we're going to put the services in place and quickly deploy these very effective programs to meet the needs of our Project Roomkey guests versus it's really hard and burdensome and difficult to do so, so we're not going to serve them, makes all the difference in the world. And then we still have a pandemic and we are in a current surge. And so the current plans to wind down Project Roomkey are very troubling. And the governor just announced 62 million more to deal with the new COVID surge, or also just to deal with the fact that there are delays in getting people into Project Homekey. And if you think of this as a great funnel, we have 151,000 people who were identified as experiencing homelessness in our 2019 point in time count. We then provide shelter to 22,000 of them statewide through Project Roomkey. We then are saying 6,000 units and perhaps 9,000 people will be served in the first year. And so each time the funnel is getting narrower and narrower. We have to look at who got left behind, particularly who at highest risk. So the 62 million, 24 million is to support continued Project Roomkey operations while local communities develop their rehousing plans, because the goal is that no one is forced to leave a Project Roomkey unit and become unsheltered. So while we don't have 22,000 currently in Project Roomkey, because people have cycled through, we probably have upwards of 16,000. And so our gap between the Project Homekey transitions and who is currently in Project Roomkey is something that has to be addressed. We then have some $35 million that's to develop and implement plans to transition individuals from Project Roomkey into permanent housing. And I think it's important that the plan is not that everyone who leaves Project Roomkey goes into Project Homekey. There are other interim housing and permanent housing that is available. And this money can be used for rental subsidies, case management, housing navigation, landlord incentives. I want to say that a lot of this rehousing is focused on what's called rapid rehousing, and it presumes that people are going to be able to handle their rent on their own as soon as they get through this crisis or unemployment or get some short-term services. And I think that that's not a model that really fits our aging unsheltered population. And I worry that this idea of short-term assistance is not a good fit with who we are talking about. And then finally, there's 300 million for technical assistance to deploy housing specialists and provide intensive technical assistance to communities to help them create plans for permanent rehousing of all Project Roomkey occupants. So we have a goal: make sure everyone who's in Project Roomkey currently is going to be given a housing option that does not put them back on the street. We do not have a plan for who got left behind, and we do not have a plan for what happens during this surge. Next slide. I'm going to skip the next two because Sasha did such a great job. If you can go, yeah, here. The only thing I want to say about Project Homekey that I don't know if Sasha's still on the call, but one of the things that I think is of great interest to this this group is there is a requirement that 10% of the Project Homekey units be ADA accessible. I want to reflect on Liz's comments that that's really insufficient given who is our target population, and that we need a much higher rate of ADA accessible units. And I think Sasha told me that there are points for reaching the 20% ADA accessibility standards. And as you can imagine, there are different, there's physical accessibility, and then there's accessibility for other types of disabilities as well. That's an incentive, but not a requirement. And we understand why in this quick environment that occurred. And I see that Maria has just put in the chat how the point system rewards accessibility, but but requires a minimum of 10%. And so we might want to think about, as this is the first iteration, but not the last iteration of what the state is going to put out in the way of NOFAs, of how we move to a more ADA accessible friendly model and set of requirements and incentives. And I think that the biggest concern is we're moving into winter. We're all hearing from the governor and from Secretary Ghali that we really need to be sheltering in place, hunkering down to stop this new surge. And it is so dangerous for, particularly for older individuals who are living on the street or living in a congregate shelter during this period of COVID infection rise. Next slide. So these are going to sound a lot like what you've heard. I'm just going to reinforce what was said, and I'm going to show you that I cannot use all my time. But these are really basic, that we have a problem, as you all know, that as many people as we get housed, more people are becoming unhoused. And that's because we have such high housing cost burdens in California. And an analysis of the American Community Survey data for 2019 showed that in every racial category, housing burdens increase for people who are renters who are 62 and over, and then renters who are 75 and over. They're paying more and more of a high percentage of their income for rent. If you look at extremely low income renters, which is 30% of our area median income, or about $24,000 a year, I'm seeing a clarification from Sasha on the minimum requirement. So I'm going to let you all read her correction. Thank you, Sasha. 77% of our extremely low income renters, those who earn or have fixed income of 24,000 or less, 77% in California are extremely severely rent burdened, paying more than half of their income for rent. And the disparate proportionality of that for Black and Latinx renters is another factor that we need to consider. So the more we can do with homelessness prevention, both in terms of building affordable and accessible housing, and also thinking creatively about shallow rent subsidies. And some communities have tried these, and they're very successful. Some have put a lot of barriers in front of being able to access this money. But it's a way to say to somebody, if I give you a shallow subsidy, I pay, let's say, 30% of your rent, so that your rent burden goes down to 50% or goes down to 30%, then I can stabilize you in your current housing. That's a much less expensive as well as more humane proposition than waiting for you to experience homelessness. Personal care services should be more accessible to older adults in all different housing types and locations. Again, I think what we just heard from San Francisco is sort of the gold star model of what we would like to see. And I think there are other communities that are doing some very interesting work. And we should have a way to share those best practices and make sure that they are being replicated, but also I want to go back to Krista's point of if you're not leveraging what you have and understanding the ability to do that, you're working too hard, that we want to make sure that we are really pushing the envelope on what we can get Medi-Cal reimbursement for. We want to really make sure that we can use existing services that are in place. We want to see that housing related supportive services can be paid for through Medi-Cal. And then this next point is really about some of the rapid rehousing and temporary or interim housing models, which is I don't feel like they are a very good fit for people who are experiencing homelessness and aging either in place or on the street, that we need models that provide a continuum of supportive services as people age and need more help. And then this final one is one that is I think a way that we can think about housing as health and health care. And if we shift from a health model that includes or provides housing to a home that blends and braids the different health services to enable independent living as people age in place, that is where we want to sort of set our sights on our policies at both the state and federal level to make sure that housing isn't an add-on to health, but it is understood as both healthcare and as racial justice. So that's all I had, I believe, and I'm happy to take questions.
Thank you so much, Patty. I think that we actually got through all of our questions that were submitted via chat and Q&A, but I noticed that Greg Thompson has had his hand up for a while. So Greg, I just want to open your line and see if you have a question or comment you want to make. And if not, we can kind of close out. Oh, and Greg just put his hand down. So I think Greg probably, oh, there he is. Okay, Greg, go ahead. Your line is open on our end. You should see a little pop-up to unmute. Yep.
Thank you very much. I just wanted to say this was an awesome presentation. And I think my question and comment is probably directed towards Krista. In looking at San Francisco, what impresses me the most is the collaboration and leveraging of existing sources. Because a lot of what you presented, a lot of the assessment, you know, these needs we've known for years and years and years, but what San Francisco has been able to do is actually impact those. So do you have any thoughts or recommendations on how a community can come together and collaborate and start to share information versus being adversarial and competitive? I'm just real curious how you guys work so well together. And thank you for taking my question.
Sure. Thanks, Greg, for the question. You know, one of the things we talked about was that we were lucky that we had established these relationships outside of a crisis, that these were ongoing and longstanding relationships that were easy to access and leverage when we got to a really difficult situation. I think what I'm lucky in San Francisco is that it's all about shared goals. We all were committed to making sure that our community was safe and well cared for. And I think you always start with that in any good collaboration, is really being clear on what you're trying to accomplish. And so there was never any point, there was rarely and probably never any points of major conflict as we moved through this, because we were all committed to making sure that we created the most flexible and easily accessible service. And that required people at the top who were in charge of funding and the money pieces of that. We really needed their, it's easy for all of us on the ground to sort of say, we need to do this, but we had to get some of that buy-in from the top. And our CFO in the Human Service Agency, my boss, Jill Nielsen, who's on here, were all committed and gave us green lights really quickly, cut through a lot of the bureaucracy that sometimes we are all stifled by, and said, just do it. And I think that, again, came down to shared values and shared goals around what we were trying to accomplish in that moment. And without that, we couldn't have done what we could do. And what we do regularly is we meet regularly. We have various forums and community groups. So we already had pre-established, communication points and these systems. So it was easy for us to get together. We didn't have to get to know each other or create a lot of new ways of interacting. I don't know if that answers your question, but I think ultimately it comes down to shared values.
Thank you very much.
Thanks so much. And I know we're running a little behind schedule, but before we close out, I'd like to introduce Kayla Shore, who's a research manager and organizer from Hand in Hand. And Hand in Hand has partnered with UCLA, the National Domestic Workers Alliance, California Domestic Workers Coalition, Filipino Workers Center, and the Golden State University, great group of partners, to launch a survey of workers, employers of caregivers, long-term care residents, and families across the state. The goal of the survey is to really understand how Californians are making this one, and really with this goal of trying to understand how we meet this growing need. It's estimated that California will need about 600,000 additional caregivers and home attendants by 2030 to support the growing population of older adults. And so, Kayla, I just want to give you the floor and let you have the last couple of minutes.
Thank you so much, Maria. I really appreciate how much I've learned from the presentation today, and for you for giving me a few minutes on this packed schedule. So I'll keep it brief as we're running over. But again, my name is Kayla. I'm an LA-based community organizer with Hand in Hand, and Hand in Hand is a nationwide network of paid and unpaid family caregivers and individual employers of home care workers. So usually people with disabilities and older adults are our members. And like many of you here, we fight for all of us to be able to live and age with dignity at home in our communities. And again, really grateful to this group for all the work that you're doing to build a better LTSS system in California. So as Maria mentioned, as part of our work with Hand in Hand, we are collaborating with the UCLA Labor Center and all these other partners to conduct research specifically on the private home care market and on board and care facilities in California. Our goal is to survey 350 of these consumers to understand, why they're making the choices they do about hiring and employment, and really help them come into this visioning for the future of LTSS in California. This research specifically in the private sector is important because we know very little about this part of this industry, right? There's data collected on IHSS recipients and SNF residents, but there are many people, as this group knows, who are in this sort of forgotten middle, not wealthy enough to afford long-term care or long-term care insurance, needing to spend down into poverty to access the available government subsidized LTSS. And, thinking about what has been talked about a lot today, I'm also thinking about how this study can help us think about, moving up the stream, looking at the financial and mental health pressures that are pushing those with LTSS needs and ADLs, who need assistance with their ADLs, to move even closer to housing precarity and poverty and experiencing homelessness. So the works is it takes about 15 minutes to complete online. It can also be conducted over the phone. The information is confidential, and anyone who's eligible and completes the survey receives a $10 Target gift card. And the reason I'm sharing it with this group is because in the context of this pandemic, it's been extraordinarily difficult to reach the folks we're trying to reach, especially with the digital divide that you all are well aware of. And again, we're trying to reach individuals who employ home care on the private market in California, or those who manage care for relatives in 6-bed board and care facilities. And we're trying to reach 250 of those people in the next 2 months. So we would love your support to reach these folks. I'm asking if folks here can share the survey out, perhaps with your email list, with colleagues who are at organizations that you partner with on the ground, on a Facebook group or social media, even with individuals who are in this situation. And it'll really help us move this study forward and think about planning for the next 10 years of aging in California. I've shared some of the links with Maria before this call, and perhaps those details can go out, but I can also just drop quickly in the chat my contact information and the survey website, and would love to connect with anyone who's open to learning more and supporting in any small way with this survey. So thanks again, everybody.
Thanks, Kayla. And I went ahead and dropped that link into the chat. So that's where you can learn more about the survey, but also take the survey. So that's probably the link that you'd want to send out, and we'll certainly circulate that around to the collaborative, probably early next week. Fridays are not ideal, but feel free to reach out to Kayla. She's dropped her email address and phone number in the chat as well. And I just want to thank everybody for joining us today for this really awesome discussion. I've learned so much. I think I'm hearing from others that they've learned a lot too. And just a reminder that the collaborative usually has monthly webinars on the third Fridays. That's not the case for December because of the holidays, and we have an internal meeting. So we will reconvene in January to cover another topic, which is TBD. So we'll announce that as soon as we get a handle on it. And just thank you and enjoy your weekend, and appreciate all of you joining us.
Mhm.